Most of us have seen those two blood pressure numbers for years. One sits on top, one rests below it. They appear on a screen, on a piece of paper, and then life moves on. Many older adults check that lower number first. If it looks calm, there's often a quiet sense of relief. The visit ends and the day continues as usual. What's rarely explained clearly is that after about age 60, those two numbers no longer carry the same weight. One of them begins to matter far more than most people realize. And it's often not the one receiving the most attention. Across everyday checkups, many people are doing everything they were told to do. They show up, they listen, they follow along, yet something important can still be missed, even when nothing seems obviously wrong. For some, the first sign that anything was off didn't arrive gradually. It arrived suddenly, disrupting routines that had felt steady for years. That kind of change rarely starts with pain or warning. It often begins quietly, right there on the blood pressure reading itself. This conversation is meant to slow that moment down, to look more closely at what those numbers are really telling us later in life, and why the focus often shifts with age. Not to replace medical care, but to help everyday checkups make more sense. If this feels relevant to your own routine, you're welcome to stay with me for a few minutes. Understanding which number deserves closer attention can gently change how people approach their daily health without urgency or alarm. Those two blood pressure numbers have a rhythm to them, even if we rarely pause to notice it. They come from the same heartbeat, yet they describe two different moments within it. The top number is recorded when the heart is actively sending blood forward. It reflects the brief instant when pressure naturally rises with each beat. The lower number appears in the quiet space between beats, when the heart rests and the pressure settles. Most people learn these definitions quickly and then move on. Both numbers are written down together, so it feels natural to treat them as equals. For many years, that's exactly how they were approached in everyday care. At routine visits, attention often drifts to the lower number. When it sits comfortably, there's sometimes a nod of approval. That small moment can linger longer in memory than the rest of the reading. It's easy to see why. The lower number tends to change less from day to day. It often feels steady, familiar, and reassuring, especially when it stays within a range people have been told is good. For decades, that sense of balance shaped how blood pressure was discussed. If one number was up, the other helped soften the picture. If both were acceptable, the reading felt complete. Many people still carry that habit today. They glance down, notice the familiar lower figure, and feel a quiet sense of continuity with past visits. That response is understandable because it's how most of us were taught to read the page. There's a pattern. Many older adults recognize the moment they hear it: a routine appointment, a familiar cuff tightening around the arm, and then a quiet sense of relief when the lower number looks good. Margaret was in her early 70s when this pattern became part of her routine. Her blood pressure readings often showed a higher top number while the lower one stayed comfortably low. Each time, the focus drifted naturally to that lower figure. She had been told more than once that keeping it under control was important. So when it looked steady, it felt like confirmation that things were generally fine. The higher number seemed like background noise, something noted but not fully absorbed. Day to day, nothing felt unusual. Her mornings followed the same rhythm. Her walks felt familiar. There was no clear signal telling her that anything needed closer attention. That sense of normalcy can be persuasive. When life feels steady, numbers that don't cause immediate discomfort often fade into the background. Many people listening may recognize that feeling of reassurance tied to a single good result. Over time, though, quiet patterns can continue unnoticed. Changes don't always announce themselves with discomfort or disruption. They often remain invisible until a routine suddenly breaks. There's another pattern that shows up just as often, though it feels very different on the inside. This one usually carries more worry, even when daily life feels unchanged. Robert was in his late 60s when his readings began to bother him. His top number usually stayed close to where it had been for years. The lower number, though, had slowly edged higher, visit after visit. That lower figure stayed on his mind. He noticed it first. He remembered it after the appointment. It felt like a signal that something was quietly working too hard in the background. At home, nothing felt off. He moved through his day the same way he always had. Yet the number lingered, creating a sense of unease that followed him between checkups. When his situation was looked at more closely, the overall picture told a calmer story. The pattern on paper didn't match the level of worry it created in his thoughts. What felt most concerning turned out to be less threatening than he expected. This contrast can be surprising. Two people, two very different sets of numbers, and two very different paths. The number that caused the most anxiety wasn't the one shaping risk in the same way. Many people listening may recognize themselves here as well. Concern often settles around the number that changes, not the one that carries the most long term weight. That instinct is human, and it's also where misunderstandings can quietly take hold. After hearing those two patterns, a natural question tends to settle in. Which number actually matters more? For a long time, the answer sounded simple. Both numbers were treated as equals, and in earlier adulthood, that approach often fit everyday experience. What worked in midlife felt reasonable to carry forward. With time, though, age begins to change the meaning of the same reading. The body doesn't respond in exactly the same way at 70 as it did at 40. That shift is subtle, and it often shows up on paper before it's felt in daily life. Large, long running population studies began to notice this difference. Researchers followed thousands of people for many years, watching how blood pressure patterns lined up with later health outcomes. Across these observations, one trend became clearer as people moved into their 60s and beyond. In older adults, the upper number appeared more closely linked with future cardiovascular events than the lower one. Not overnight, and not in every individual, but consistently enough to change how experts interpreted risk over time. The lower number still carried meaning, yet it no longer held the same weight it once did earlier in life. This wasn't based on a single snapshot or a brief trial. It emerged from decades of data, collected quietly. As people went about their normal routines, patterns only became visible after many years had passed. What stood out was how the same numbers told different stories at different ages. A reading that might have raised little concern at 40 could take on new significance at 70. The page hadn't changed, but the context had. Many older adults sense this shift without having words for it. Appointments feel familiar, yet the body doesn't quite respond the way it once did. That difference is often noticed gradually, long before it's discussed directly. There is a pattern that appears quietly on many blood pressure readings later in life. The top number drifts higher, while the lower one stays the same or even eases down. On paper, it can look almost balanced, even reassuring at first glance. This pattern has a name, though many people live with it for years without hearing it spoken aloud. It simply describes a higher upper number alongside a lower number that seems acceptable. Nothing dramatic, just a subtle widening between the two. As people move into their 60s and 70s, this becomes increasingly common. Daily routines stay familiar, energy may feel unchanged, and the body adapts smoothly. Because of that, the reading often blends into the background of regular checkups. For a long time, this pattern was often brushed aside as part of getting older. The lower number looked calm, so the situation didn't feel urgent. It was easy to assume that age alone explained the change. That assumption lingered for years. Many people were told, directly or indirectly, that nothing needed to be done right away. Life went on, supported by the idea that this was simply how numbers behaved with time. As larger groups were observed over longer periods, a different picture began to form. People with this pattern were experiencing serious cardiovascular events more often than expected. The numbers themselves hadn't seemed alarming, but their long-term meaning was becoming clearer. When this pattern was addressed more thoughtfully, outcomes began to shift. Treating the elevated upper number was associated with fewer strokes and heart-related events in older adults. The change wasn't felt overnight, but it showed up steadily over time. Many people listening may recognize this habit of reassurance. A familiar reading, a quiet dismissal, and the sense that age alone explains what the body is showing. That way of thinking is understandable, especially when nothing feels immediately different day to day. Yet subtle changes often begin well before they announce themselves in more obvious ways. Over the years, blood vessels quietly change along with the rest of the body. They don't announce it, and most days, nothing feels different from the inside. Earlier in life, arteries tend to respond with ease. Each heartbeat sends blood forward, and the vessel walls gently expand before settling back. That flexibility softens the pressure and spreads it out smoothly. With age, that response becomes less forgiving. The vessel walls gradually lose some of their give. They don't stretch the same way they once did, even though the heart continues its steady rhythm. When blood is pushed into a vessel that no longer yields easily, pressure rises more sharply at that moment. The upper number reflects this brief surge. Meanwhile, the lower number may stay close to where it has always been. This is why the two numbers can drift apart over time. The heart hasn't suddenly changed its intent, but the pathway it sends blood through responds differently. What once felt absorbed now feels more direct. A simple image helps many people picture this shift. Pushing water through a soft garden hose feels smooth and controlled. Sending that same flow through a stiff pipe creates a stronger jolt at the start. Many older adults sense this without realizing it. The body feels mostly the same, yet readings slowly look different from years past. Nothing dramatic happens in a single day. These changes unfold gradually, woven into ordinary mornings and familiar routines. They often appear on paper long before they're noticed in any other way. When that stronger surge happens again and again, it doesn't stop at the vessels themselves. It travels onward, touching organs that depend on a steady, gentle flow. The brain is one of the first places where subtle changes can appear. Tiny vessels there are meant to handle a smooth rhythm, not repeated forceful pulses. Over time, this can leave small marks that don't cause pain or immediate disruption. Many older adults notice changes gradually. Moments of forgetfulness feel a little more frequent. Focus doesn't always settle as easily as it once did. Nothing dramatic, just a quiet shift that's easy to attribute to normal aging. The heart experiences this pressure differently. Each beat must push against that firmer pathway day after day. At first, the body adapts and everything feels steady enough. With time, that constant effort can change how the heart moves and rests. Stairs feel a bit longer. Recovery after activity takes slightly more patience. These are small signals, often brushed aside as part of getting older. The kidneys, too, rely on delicate internal pathways. They work quietly, without sensation, filtering and balancing behind the scenes. Repeated pressure over years can slowly alter how smoothly that process unfolds. What makes this pattern difficult to notice is the absence of discomfort. There's no clear moment that demands attention. Life continues, habits remain, and routines feel familiar. Change here is measured in years, not days. It accumulates quietly, shaping how the body responds long before anything feels clearly wrong. As these patterns became clearer over time, clinical guidance slowly began to shift as well. Not abruptly, and not in a way most people notice right away, but steadily. In more recent years, modern guidelines have started using a lower threshold to define elevated blood pressure. You may have seen the number written as 130/80. It shows up on paperwork now, sometimes without much explanation. For many adults, that number is meant as an early signal rather than a verdict. It reflects a growing understanding that subtle elevations can matter over the long run, especially when they persist quietly. For older adults, there's an added layer to how these numbers are viewed. Guidance places particular emphasis on the upper number because that's where risk tends to concentrate with age. The lower number still matters, but it no longer carries the same priority it once did earlier in life. In everyday practice, this distinction can easily blur. A reading comes back, the lower number looks steady, and the moment passes. Reassurance arrives quickly, even when the upper number has been edging higher. That response is understandable. Appointments are brief, and numbers that look familiar feel comforting, yet this is where context becomes important, especially later in life. Targets are not meant to be rigid or identical for everyone. Overall health, daily stability, and how a person feels all shape what makes sense. What's appropriate for one individual may look different for another. Still, the general direction is clear. For many people over 60, paying closer attention to the upper number has become an important part of long term care. That shift reflects how the body itself changes with time. Once those targets are understood, daily life becomes where things truly take shape. Not in a single appointment, but in the quiet rhythm of ordinary days. For many people, simple lifestyle habits form the foundation. What's eaten most days, how often the body moves, how rest is protected at night. These choices don't create dramatic changes overnight, yet they gently influence how the body responds over time. For a large number of older adults, those habits alone are not always enough. This is where medication often becomes part of the picture, not as a sign of failure, but as a practical tool that supports the body as it is now. Some people are surprised by this. They worry that needing medication means something has gone wrong. In reality, many bodies simply respond differently with age, even when daily habits are thoughtful and consistent. What matters just as much is how blood pressure is observed outside the clinic. A single reading in a medical office captures only one moment. Morning and evening patterns at home often tell a much fuller story. Many people notice that their numbers feel different at home than they do in an exam room. Calmer surroundings can change how the body responds. Regular home checks help reveal what's happening most days, not just on appointment day. This is also where common misunderstandings begin to soften. Feeling fine doesn't always mean nothing is changing. And family stories of people who did just fine without treatment rarely show the full picture. Daily consistency tends to matter more than any single reading. The small things done each morning and evening quietly shape long-term patterns, often more than people realize. Margaret's story stays with many people for a reason, not because it was dramatic in the moment, but because it felt ordinary right up until it wasn't. Her days followed familiar patterns, and her readings often looked partly reassuring. What changed everything was not a sudden feeling in her body. It was a number that had been quietly present for years, waiting to be taken seriously. That upper number never demanded attention, yet it carried more weight than anyone realized at the time. After 60, blood pressure no longer speaks in the same way it once did. The lower number can look calm and steady, while the upper one tells a different story. Learning to notice that shift can change how people relate to their everyday health. Information like this only matters when it becomes part of daily awareness. Checking numbers with a little more intention, noticing patterns over time, having clearer conversations during routine visits. No one else lives inside your body. No one else sees these numbers as often as you do. Paying attention is a quiet form of care that belongs to you. If this kind of clear, steady guidance feels helpful, you're welcome to stay with us by subscribing here. You may also choose to share this with someone you care about who checks their blood pressure regularly. And if you feel comfortable, you can leave a comment about what you've noticed in your own readings. Thank you for taking this time and for giving your attention to something that often goes unnoticed.